Hi, my name is Kaylie Morgan. I just finished my internship at Tender Ones Therapy Services, also known as TOTS, in Gainesville, Georgia. There's also a location in Decula, as well as the newest location in Brookhaven. So, in this position, they have speech therapy, occupational therapy, and physical therapy, and they work with kids ranging from 0 to 21 years old with various developmental delays and disorders, um, including anywhere from autism and ADHD, speech delays, to traumatic brain injuries. Um, in this environment, you would be exposed to all three, which is one of my favorite aspects as someone who is focused on speech therapy, as that's what I'm planning on pursuing. I enjoyed being able to even have opportunities to follow some of the kids from all three therapies and just talk one on one with the therapist about the child's individual goals, and just the purpose behind the exercises that they were doing and things like that. It was super helpful to just have a deeper understanding of this information. And then also, along with this, it was super helpful to be able to talk with people, the speech therapists who have already completed all of their education, and just talk to them about how they got to where they are now, and just the different opportunities and perspectives that they each individually have. Um, and then another thing is that with working with kids, especially kids who have various delays and disorders, as I mentioned earlier, there's a lot of different behavior that you would have to sometimes handle, and especially in these situations, no two kids are the same. So it was very helpful to me, in my opinion, to be able to just experience situations where some of the therapists had to deal with some behaviors, and just to see how they interacted with the kids, and how they handled those difficult situations. For the cons, I think it's not really a con in my opinion, but the only kind of downside of being an intern is that you would also be required to do some of the other duties around the clinic that would just help the clinic run properly and allow the therapist to have more time focusing on their patient and the patient's families. So these duties could include anything from laundry to cleaning the bathrooms, and just keeping all the surfaces and the toys regularly sanitized and things like that, which this can take away from some of the learning time and observing time, but the therapists truly understand that you're an intern first and you're not getting paid for what you're doing. So observing comes first and learning comes first to them. And just kind of in my experience, in between the sessions, when my advisor didn't have a patient at the time, I would go around and do some of these other tasks around the clinic. And then I can only speak of my experience as a speech therapist, but I can confidently say that anyone looking for an internship in the fields of occupational, physical, or speech therapy would find a great opportunity at TOTS. And anyone who is looking for a position like this, I would strongly recommend that you have great communication skills to communicate with your direct advisor and the other staff members on your team, as well as great multitasking and flexibility skills. Because in this position, you're constantly moving around from one place to the other, and being asked to do multiple jobs and helping out in multiple places at once. So just being able to move back and forth quickly and keep everything on time, and just focusing on everything all at once would be my biggest recommendation.